No matter how healthy we are, we're bound to get a sore throat occasionally. It's not only uncomfortable, but it's an important part of our body's immune response. There could be several reasons for a sore throat, but if the feeling persists for more than a week and is accompanied by a fever or difficulty swallowing, it may be time to get medical treatment. Severe or persistent pain may indicate strep throat, tonsillitis, or another serious problem. The specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery talk to us about how they hunt for the cause of a sore throat.
Some common throat conditions we see are from allergies, postnasal drainage, acid reflux, swallowing problems, voice issues from either or all of the above. If somebody is having a sore throat, generally you'll look for other systemic issues such as a fever, chills, sweats, how long it's been going on, and on exam looking at their throat, is there evidence of pus in the throat, tonsil inflammation, is the back wall red, and there can be some cobblestoning, which is a clinical term we use that suggests postnasal drainage. And then looking down at the throat either with an indirect exam with a mirror or with a flexible endoscope to look at the voice box and see if there's some redness or swelling or if there's any lesions or problems with the actual vocal cords. Regarding the nose and the sinuses, that's a very frequent problem area in Florida with allergies. So most folks have some underlying seasonal or year-round problems with inflammation, congestion, runny nose, and then sinus pressure, recurrent sinus infections. People with throat infections may be more ill with fever, chills, sore throat, more trouble swallowing, breathing sometimes.
Frequent infections is the main thing. An adult that gets 4 or 5 episodes of strep throat or severe sore throat per year, and having to miss work and just the pain and suffering associated with those infections, then it usually is worth considering tonsillectomy just to get rid of that type of medical problem. We also see kids that have a lot of tonsil problems, and they can manifest in several different ways, including sore throats and strep throats, which occur very frequently. But also children can have enlarged tonsils, and that can cause a variety of other problems, including snoring and sleep disordered breathing, which includes sleep apnea. And that's actually where a child actually stops breathing for 10 or 15 seconds at a time and almost has to wake themselves up to continue breathing.
Tonsillectomies are generally an indication in children that have recurrent strep throat, generally 6 to 7 a year. And also if they have evidence of sleep apnea or symptoms consistent with sleep apnea, adenoid tonsillectomy is recommended. In adults, you're usually a little more conservative with recommending, but generally if they also are a candidate from a standpoint of sleep apnea, recurrent tonsil infections, or if there's some concerning pathology, if one tonsil is bigger than the other and they're a smoker or have some other risk factor, you'd want to take the tonsil out.
For more information on this story, as well as links to the specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Sore Throat Solutions story link on our homepage at yourhometownhealth.com.